This is Dr. Jerry Hesch. I am a physical therapist at Hesch Institute in Aurora, Colorado. And I want to talk about hypomobility in the upper four rib joints where the ribs connect to the vertebrae. Now, a vertebrae of the spine will have this front mass called the body, the vertebral body. And then they have this point that comes down called the spinous process. And then there's a lateral projection. And the lateral projection is called the transverse process. Now, all of these articulations have ligamentous, all of these bones have ligament and muscular attachments. And the rib joint is a very, very strong joint. And we're going to ignore the anterior rib cage for now and discuss mostly where the rib comes. Think of it as a curved finger coming along and abutting against the transverse process, making a joint there, and then bumping up against, in some levels, the disc, even the vertebrae above, and the vertebral body below as well. So with thoracic movement, we also have a little bit of rib movement, primarily in and out. Ribs can move up and down a little bit, but the motion I'm mostly concerned with in this presentation is the inward and outward rotation of the rib. Well, most of us, a large number of us, carry our tension in the upper body. Some of that tension can be described as muscular, and if stretching and massage gives you long-term relief, then you're on the right road to managing it. Some people lie on a foam roller, and I've seen some that are 5 inches diameter, 6 inches diameter, 8 inches diameter, and I think that's excessive. And the diameter I like is a 4-inch diameter open cell because it yields a little bit and conforms to the shape of the body, and the person becomes more comfortable. So a lot of people will do foam rolling on their back, but based on the curve of the rib cage and such, that is not the most effective way to increase mobility when there's stiffness in the rib joint. And I'm going to take that phone call and come back and do a part 2.